Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and I'm here this week at the Colorado Springs 39th Annual Winter Symposium, started by Dr. Gary Forrest. And this morning I want to have an interview here with a couple of people who share the exhibit booth next to me from Dominion Diagnostics. So Mary, why don't you tell us a little bit about yourself and about Dominion?
I'd be happy to, Steve. Dominion Diagnostics is a national laboratory. We do drug testing with programs all over the country. Our specialty is working with drug and alcohol and behavioral health programs. We started about 15 years ago. And our main mission is to make sure whatever tools we're providing to the clinics are tools that can be used effectively in treatment. And we provide clinicians with the best testing results, but beyond that, we provide support. We'll help clinicians interpret results so there's no confusion about cross-reactivity, false positives as they're known in the business. We have a team of pharmacists that answer any question. We provide clinics with outcome summary data that you can actually monitor that if the client is actually taking a prescribed medication, are they continuing to abuse drugs or not. So what we're trying to do is make sure that the paradigm of drug testing has shifted from a punitive to a clinical tool.
So a therapeutic tool rather than a let's catch them tool.
Absolutely.
Gotcha rather than a
The gotcha rather than the gotcha.
mentality.
We'll talk about how to use the test clinically with your patients.
So how user-friendly is it?
It's extremely user-friendly. We can the results come back to the clinics within 24 hours. We provide you any kind of media that you have. So if you have an electronic health record, we link into that. We have online order systems, so it's completely paperless. If it's a program that actually likes to hang on to that paper, we actually can do a paper process. So we will meet any format, any need that the clinic has. Uniquely to Dominion, we will also customize whatever your testing profile is.
You mean one size doesn't fit all?
It does not, nor does the 10-drug profile fit every treatment center.
Exactly.
We know nationally drug trends are very, very regional.
Very unique.
And they're unique. For example, in the Mid-Atlantic area, we always recommend PCP be on the profile.
Right.
Because it's been a continual problem in the Mid-Atlantic. We would not recommend that in many other parts of the country.
Right.
Unless we see a trend of that starting to happen. So you can customize. We don't encourage over-ordering a test. We want to make sure whatever the clinical tool is, it's going to meet your client's needs.
Great. And how about introducing yourself?
Okay. My name is Kimberly Mitchell, and I'm the Regional Addiction Specialist for the Western region. Basically, I cover the Western states, and I also go into clinics, and I will introduce Dominion Diagnostics and help programs start to use our clinical services, and I provide ongoing technical support. So it's not like we just come in and we sign you up and you never see us again. We're really a hands-on type of laboratory where we really want to help you, help consult with you to bring about the best testing protocol for your program.
So what led you to be drawn to them? What was it about?
Well, first of all, I've worked in the field for over 20 years. I ran treatment programs and such, and to be very honest with you, my knowledge and understanding, even though I was working in the field, didn't really understand laboratory and how it could really help. I always saw it from the perspective of catching somebody on something or whatever, and I was approached by Dominion Diagnostics, and I've been working with them for over 5 years now, and everybody that I know that I put a program in place, they are completely satisfied with Dominion because we really do what we say we're going to do. We don't overpromise things that we can't provide, but what we do is we understand what addiction programs are doing. We understand because the people that we hire are people that have worked in the field, and I think that that's of great value when we're talking about something as important as a good clinical drug test.
Okay. So Mary, why don't you close us up in about 30 seconds or less, and just anything else that you think it would be important for the folks to know?
Well, I think that the main thing is, and I'm just going to reiterate what Kimberly said, we all know, having been a clinician myself for many, many years, the worst thing you can do in a clinical setting is confront somebody with a piece of bad information.
Right.
it provokes all that bad clinical interaction. So having a company working with you that's going to ensure accuracy, that's going to provide you with the tools you need, that's going to help explain to the client exactly what the drugs are doing and how they're eliminating out of the body, can only be a win-win for everybody. We're all here for the recovering client. That's our mission. It will continue to be our mission, and it's where the company started, and it's where we thrive.
And this is a great adjunct to any multidisciplinary approach, and you'll be able to track your outcome data really well with this system. So I'm going to close for now, but thank you so much. And remember, freedom from suffering is everyone's right, but it's also their responsibility.